Yes, we can start. Okay.
All right.
We'll start now.
Yep, it's 7 o'clock. Some people
Yes.
are still coming in. But we can already start. So we are live in Facebook at Wellnessland Health Education. So good evening, everyone. And so thank you for your time, El Calinado. El Calinado is live from Taipei, Taiwan. Just a short background, I met him several years ago in Maya Earth Village, Palawan, and he has also conducted some workshops at our institute, Wellnessland Health Institute. He's, as you have seen already in the introduction, he's an international healer, and of course we will know more about him as we go along tonight. So as I will be admitting some of the participants, and at the same time there are also more and more people watching us now live in Facebook. So without much further ado, please take it away, Mr. El Calinado.
Good evening. Thank you for watching. So my title is The Emotion Iceberg, which can be unusual, but I want to emphasize that emotions can have a huge, huge, huge impact on our health, especially the emotions that happen at an early age. When you're a child, when you're a baby, any emotions can be imprinted 10 times what they actually look like from the outside. And I want to start by giving you an example. There was a little girl who was 2.5 years old, and she was having a very good life, like a normal baby, growing up, starting to be a toddler and then walking around. But when she was 2.5, she became obese very quickly. And her parents couldn't understand why did she become obese so suddenly. So they took her to a psychiatrist, they took her to the pediatrist, to the doctor, to the psychologist. Nobody could find out why she was getting so big. By the time she was 5, she was still very big. So the psychologist suggested that she would go to an art therapist. And the art therapist asked her to draw a portrait of a family. So she drew her father, she drew her mother, and she drew herself. And then the art therapist asked her, why did you draw yourself bigger than your mother and bigger than your father? And the answer of this little girl was, this way my mommy cannot throw me in the garbage. So it was a red flag to the art therapist, and she talked to the mother, and she said, this is what happened when I asked her to draw herself and a family, and she said she drew herself bigger because she didn't want to be thrown in the garbage. Does that mean something to you? And the mother said, oh my God, I remember when she was about 2.5 naughty, and I said, stop it or I'll throw you in the garbage. Now, in a 2.5-year-old's mind, this is truth coming from the parents who are the authority. So she figured that if she could make herself bigger than the garbage, a mother couldn't throw in the garbage. So this was the cause of her obesity. It was definitely an emotional cause created by the fear of being thrown in the garbage. And it's so often that people have an emotional trauma that looks very small from the outside, but because they are children, it's amplified 10 times or 100 times. And this kind of trauma I see more and more with people having cancer, depressions, chronic fatigue, even multiple sclerosis. I had 2 patients with multiple sclerosis who totally recovered after an emotional reprogramming. Now, when we have emotions, it creates kind of a domino effect on our health. Like the first thing that happens when we have a strong emotion is our breath will change. And it's very obvious when we watch a scary movie. We watch it and we go, ah, and we release the breath because we feel it's not scary anymore. But this holding of the breath that happened during a scary movie is happening for people who live in fear constantly. Like a child who is afraid to be hit by the parents or who is afraid to be abandoned by the parents is going to have this fear inside him all the time. And he's living in constant fear. So his breathing is going to be affected. And when the breathing is affected, it will affect your endocrine system. And that's where things start to go very wrong. Because affecting the breathing will affect the endocrine system, such as the thyroid, thymus for the heart, pituitary gland. And then we have another chain reaction where the production of hormone is being disturbed. And I'm sure that you will agree with me, Romy, that when the hormones are being disturbed, the total health situation is being disturbed.
Yeah, that's right.
So the emotion is really the cause of this disturbance. So it's why, and I know that's how you work, like when you give drugs to people, I mean, you used to work like this before, but you realize this was the wrong attitude to just give drugs for the symptoms.
That's right.
Because we really have to treat the cause. And so often the cause is anchored in the emotions of the child or the adult. I found, for example, it's very common for people having to have trouble in relationships. So they try to get a relationship and then it fails. They try to another one and it fails. And these people, I have a question to ask them. I said, was your birth an accident or was it a planned birth? Almost every time these people say it was an accident. So these people, because they were born out of an accidental pregnancy, they feel the emotion of the mother, which is anxiety, shame, guilt, fear, during the pregnancy. So they are born with all these emotions already imprinted in them. So the fear and the anxiety is creating a fear of relationship in their adulthood and even in their childhood at school. So they have a hard time making friends. They're afraid to be rejected. They're afraid to be unloved. That makes sense?
Yeah, yes, definitely.
Yes. And then these people will not only have a fear of relationship, but then they will withdraw into a stressful life where they will experience very often depression because we need other people to live with. And if we can't live with other people, we feel very inadequate to be living in this society. So then we will have these people who withdraw into depression, or then they will try to belong to a group so much that they will belong to the wrong groups. By that I mean like a gang. You know, like a gang, because teenagers who have a lot of anger, they can't belong to any groups. Then they will try to find anything to belong to. And then often they will search a group that will accept them, and a gang will be the only group that will accept them. And then they will turn into crime because they have this anger and this difficulty in making connections with others.
So, does the memory of the, let's say, the patient or the one affected, is it an mental memory or a cellular memory? Can you expound more on that?
Okay, so there is a lot of memories that are being suppressed by the subconscious.
Okay.
And usually in childhood, the reaction of a child usually is to suppress anything which is a negative memory. And then they will suppress at the same time a whole part of their childhood. So if you have a good childhood, you remember usually pretty much since you are 1 or 2 years old. But when I ask some of my patients, do you remember when you were 7 years old? No. When you were 6? No.
No.
I say, what about when you were 8 years old? Yes, I remember 8 years old. But 7? No. 9 years old? Yes. Okay, so something happened when you are 7 years old. What happened? There was a trauma in your life? Oh, that's when my parents split.
Mm-hmm.
Ah, okay. See, so you don't remember anything before your parents split, but you only remember after. So how was your parents splitting? How it affect you? I can't remember. See, they tried to block it because it was so painful. And this blocking of this memory is actually the bottom of the iceberg. So this big part of the icebergs we don't see is actually what's creating the pain, the anger, the fear, the anxiety. And when we can reconnect to this, then we can reprogram it, and then they can be free of it. So this is the beauty of the emotional reprogrammation that I do, and I learned that from a psychiatrist in Canada called Dr. Boehner. And I'm so happy I learned this method because it really, really changes people's life. Now, it's true there is also a cellular memory. And cellular memory, interestingly enough, can be transmitted from the grandmother
Mm.
because the grandmother is the one that made the egg that made you, the grandmother on the mother's side, because every baby is female is born with the eggs already.
Mm-hmm.
So these eggs were actually made inside the grandmother. And these eggs are the biggest cell in the body.
Mm-hmm.
And it will divide into all the cells of your body. So I had a very clear case once with a lady who had nightmares every night about the war. And she says to me, I can't understand why, because I've never been in a war. I don't read books about war. I don't even look at the news. I don't read newspaper. Why I have these nightmares every night? So knowing this thing about the grandmother, I said to her, when was your mother born and where? And she told me, my mother was born in 1916 in England. I said, during the war? She said, yes. I said, was her husband at war? She said, yes. So I say, imagine the anxiety of a mother with a husband at war when there is no telephone, no TV, of course, in 1916, and the only news is what you see on your newspaper or from other people, and she's pregnant. Her husband is away at war, and it's during the war. Imagine the anxiety. I said, this anxiety was passed on to you through the egg. And then she said, really? So I said, yes, we're going to reprogram use the cells in your body to let go of anxiety that came from your mother. So because of this reprogramming method, we can access the subconscious. We can send a message directly to all the cells. So we let all the cells go out of this anxiety about the nightmares of the war. And the next day she slept normally. She had no more nightmares.
Mm. Wonderful.
And she had nightmares all her life about this war that she never seen, but it was passed into her genetically. And there's a proof now that we can read in a medical paper, which was done with mice. And they proved that in one generation, only one generation,
Mm-hmm.
you can transmit fear from the mother mice to the children.
Really?
So what they did, they put a cage with quite a number of mice, male and female.
Mm-hmm.
And in one corner of this cage, they installed some electrical wires and a scent, like it was, I think, rose scent.
Mm-hmm.
So whenever the mice go in this corner, they get a little bit of electric shock on their feet, which is very unpleasant, and they smell this rose. So they associate the smell of the rose with a shock. So then they change the smell of the rose, put it in another corner where there is no electrical shock.
Mm-hmm.
Well, they avoid this corner because they remember that the smell of the rose means being shocked. And then these couples of mice will reproduce. And then when they are having babies, they put them in another cage with no scent, no electrical shocks. But when the babies are old enough to be on their own, they bring them into a cage, which has the scent of the rose in a corner, no electrical shocks. the babies avoid this corner because the mother transmitted the fear of the smell of the rose in one generation.
Yeah. Uh-huh.
And the same thing happened to us. Why are people afraid of snakes? Most people, I ask them, are you afraid of snakes? They say, oh yes, I'm afraid of snakes. I said, did you ever see one? No, I never seen one. Because it's a transmission of fear from one generation to the next.
So the
And
transmission is a it's an unconscious transmission.
unconscious transmissions.
Unconscious.
So it is unconscious transmission, yes. It's transmitted since you were conceived, basically. Because there was a fear transmitted in the reproduction.
Mm.
So this is very important to know because some people have fears, they don't understand where they come from.
That's right.
Or they have anxiety and they wonder, like this woman who had these nightmares about being in a war all the time. She said, where does that come from? Because they have no exposure to that. But then when we found out that the grandmother had been exposed, and then the cell that made her, this big egg cell, divided into every cell in a body, including all the neurons, then we understand there is an imprint of the emotion.
Mm-hmm.
And it's this imprint that causes a trauma. Now, rather than suppress it with sleeping pills or with drugs, we can actually reprogram it, which is a safe method, which I've been using for many years now.
Yeah. Yeah, it's because the most common treatments of mental and emotional disturbances right now, especially in the medical field, is they are given medications.
That's right.
Yeah, in fact, I have seen more and more patients, especially during this pandemic, who have some sort of mental and emotional disturbance, of course, with all the challenges during these pandemic times. But true enough, as you were saying, that it's not just this period of time, pandemic time, there's something deeper. There's something far beyond, far before, way before. Yes, it's just like there's some trigger today. And my question is, how do you deal with people who approach you with this emotional reprogramming, which I will ask you more about it later, who are taking medication? Do you just tell them?
Okay, so I don't suggest that people suddenly cut medication.
Okay.
Because most of the time there's a form of addiction to the medication.
That's right.
So I ask them to reduce it progressively.
Progressively, gradually.
And to me, that's a safe approach because when you suddenly cut somebody off medication, it can create some adverse effects because the body is addicted to it, especially when it's drugs for psychological problems such as antidepressant and sleeping pills and things like that. But I'll give you an example of a lady who was totally addicted for how many years? I think it was 2 years. She was addicted to sleeping pills.
Mm-hmm.
And she was a professional photographer from Australia.
Mm-hmm.
And she says to me, I'm getting so tired because I can't sleep at night. I have insomnia and I'm getting more and more pills. And every time I go to the doctor, it just gives me something stronger. And I'm getting really tired in the day. And at night, I have to take these pills, otherwise I can't sleep at all.
Mm-hmm.
And I said to her, you told me it started 2 years ago. So if this problem started 2 years ago, something changed in your life 2 years ago. She said, yes, I split with my boyfriend of 7 years. And I said, what happened? He said, well, I thought it was the wrong relationship, but then I felt really bad because I felt it was actually a good relationship and I should have stayed. But now he's married, it's too late. So you feel like you did something wrong. She said, yes, I still feel that. I said, you have an emotion inside you of guilt and shame and maybe anger towards yourself. She said, yeah, that's exactly what it is. So you never forgive yourself. She said, no. I said, well, we're going to reprogram that so you can sleep again.
Mm.
So I said to her, after the reprogramming, I said to her, now, I don't want you to stop the pills right away, just take half tonight and see how and then eventually you will cut it down so that you don't need any pills. And 3 weeks later, she sent me an email. She said, "It's amazing. I don't need pills and I sleep well every night."
Wow, wonderful.
So it's so simple, because if you get addicted to sleeping pills, your health is going to be affected.
Definitely. Yeah,
So it's dangerous. It's a dangerous path, because see, the problem is not the sleeping. The problem is finding the cause of the insomnia.
that's right. And that's what I've been saying. I've been writing and I've been sharing to people for quite some time already that instead of treating the symptom, treat the root cause.
Absolutely.
Yeah. So in terms of emotions, what are the most common emotions? I've heard you said about fear. What
Fear is a
else?
very big one.
What else
Fear,
other than fear?
anger,
Mm-hmm.
shame,
Shame,
guilt. And of course,
guilt.
we find shame and guilt in the places where religion is very important.
Mm.
Like we find much more shame and guilt in the Philippines than
Yeah.
we find in Canada, for example,
Mm.
because of the impact of the religion.
Yeah.
So we have to understand people's religion too. I
Yeah.
mean, sometimes it does some good thing, but sometimes it can create a lot of fear, a lot of guilt and shame,
Mm-hmm.
which can create big problems as emotional um, and also physical problems.
Yeah.
Yes, so it's very important to have a balanced life, with emotions.
Yeah.
There's nothing wrong with emotions. Emotions are here to tell us how we react to things.
That's right.
But, but if we acknowledge the emotion and understand it without reacting right away, like if somebody makes you really upset and you
Yeah.
feel anger and you punch them in the nose, it's not going to solve the problem
Yeah.
because you become a victim of your emotions. Or
Mm-hmm.
if you have a fear of dogs and you have such a fear of dogs, but you hide from dogs, which I have seen. People who had such a fear of dogs, they can't even go on a street where there's a dog.
Yeah.
So these emotions will create a big problem in your life.
Mm-hmm.
So once you know that your emotion is there, you can actually acknowledge it and reprogram it.
Mm-hmm. So the
And in
first,
this reprogrammation is very simple. I taught it to people as young as 12 years old.
wow.
And actually, I had a very, very surprising thing happening 2 days ago. I met some people that attended one of my workshops in Taiwan, and these people had a 5-year-old kid. And this 5-year-old kid, but I was really surprised, he was listening the whole time. He speaks both Chinese and English. He was so attentive, so listening, and I thought this is kind of unusual. Well, the parents told me a couple of days ago when I saw them, they said, but recently he woke up with a nightmare. And you know what he did? He went to his mother and he said, "Mom, I had a nightmare. Can you help me reprogram this fear?"
Mm.
He was 5 years old. So, so he totally got the concept of reprogramming. And I think this should be taught in school, because it's such a good thing. And talking of schools, I had a friend who was a school teacher in high school, and she noticed that the students had a lot of anxiety and fear of failing when they were going to an exam. So she tried an experiment with her. She said, "We're going to do a reprogrammation just before the exam. It only takes a few minutes, and we're all going to reprogram the fear of failing and the anxiety about the exam so that you can have a normal breath and you can feel totally relaxed, and then you probably do better." They all agreed to do it, and they all got better results than expected.
Mm. Yeah.
So
So you
that's a
speak about
master production.
yeah, very good. You speak about this reprogramming. Can you share to us the process? Uh, can you share to us the process how you
Uh,
facilitate or how you assist people with anxiety disorders, panic disorders, depression, or whatever form of emotional and mental disturbance?
okay, so the
There's
first
a general
part,
process.
I do, if I am if I have the people present with me, like physically present, I will do a little test with energy medicine to find out which part of the body is imbalanced. So this is a very simple test, so I can concentrate my questions very quickly, so I can find much more quickly the problem. If the people are online, what I do is I ask some question about their general health and their emotions. So some people tell me, oh, I have a lot of anger. I say, well, since when do you have anger? Or since my husband left. Oh, so you feel a lot of anger towards which people? Towards your family or towards your hands, but towards everybody. So then we can figure out, okay, the anger is a problem. Or sometimes people, I feel very sad. Why do you feel sad? Oh, because my father died. Okay, so we have a point to start with. So we try to find first the cause of the emotion. Sometimes it's not easy because the emotion can be anchored in childhood or even in the birth.
They can be very suppressed.
Yes, yes. Or sometimes just one little event that happened in childhood or during the growing up period can be huge trauma. Like when I was in Bai Calipai in Puerto Princesa, one of my clients, she said she had an awful time with relationship, but she really wanted to have a relationship, but she said she had a really hard time. And then after questioning her, and she had the throat chakra in the thyroid, which was totally blocked. So I said to her, I think you have a secret, or you have something you are afraid to tell other people. I mean, you have something, some truth to say. And then she starts crying, and she opened up and she said, yes, I was sexually abused between the age of 7 and 11 by my stepfather.
Oh.
And on top of that, he said, if you tell your mother, I'll kill your mother. So see, she was submitted first to sexual abuse and then to silence. She was blackmailing to silence. So it was a trauma she experienced for 4 years of her life. And that's huge for a child,
Yeah.
Even for an adult it could be huge, but even more for a child. So no wonder she had a hard time with sexual relationship, because she had this fear constantly with her. So this is very important to be aware that all the events that happen to us since we are born and even before as a fetus can affect our life. So my work is to find out what is the cause of the imbalance in the body. And then have people coming with disease like cancer or multiple sclerosis or chronic fatigue. And then I have to tell them, first of all, that what you see is a symptom. It's not really a disease. I mean, to me, a disease, if that's obviously physical, is that like some friends recently went into campings in a woodland and it was wet, and they got bitten by a mite which caused typhus. So typhus is a really dangerous disease. Or Lyme disease is a very dangerous disease, and it has nothing to do with your psychology or your emotions. So I tell these people, go to the hospital right away.
Yeah, of course.
Or if you break your leg, go to the hospital. They do a great job of fixing it.
Yeah.
But the people who have, this problem, like to me, cancer is not really the problem. We have to find what's the cause behind the cancer. So sometimes it's physical because people work in a chemical factory, or they are smokers, or they eat the wrong food all the time, So this is physical condition. But I found that a lot of time there is actually an emotional condition behind the cancer.
It's also my observation, L, that some cancer patients, especially those with cancer of the reproductive organs, have some form of, not all, but I see it more common in patients with cancer of the reproductive organs. They have some form of bitterness in their hearts. Can you share some more insights about that? What is the connection? Because in medical school, as far as I'm concerned, I did not learn any connection between bitterness and cancer.
Yeah, the bitterness actually is anger usually.
Yeah. Prolonged anger or expired anger.
Yes. Yes, there's a lot of emotions that come around sexuality. There's also shame and guilt.
Mm-hmm.
Um, I had last year I was in China and I was invited to do some healing in the town of Shandao.
Mm-hmm.
And the people there suffered a lot of pressure from their parents during the revolution.
Mm-hmm.
Because the people were very poor, they were very upset. So now the next generation is really affected by what happened with the parents.
Mm-hmm.
And a lot of people need this kind of help. And I was working until 11 o'clock at night sometimes because there was a lineup of people. And I spend usually an hour and a half or 2 hours per session. So I don't rush it.
Okay.
But some people want to see me, after work, so they would come at 7 o'clock, 9 o'clock, 10 o'clock. So I was working a lot. But there was one woman in particular that had a little event that affected her whole life. And it was such a small thing. When she was a little girl, she experienced pleasure while masturbating, and she thought it was wrong. In her idea of like a 6-year-old girl, she
Mm.
thought she did something wrong because it was such a strong sensation for her body.
Uh-huh.
And her whole life was affected by this event. And she never told anybody. And when she was telling my translator and myself, she was almost choking on it. She was like, so anxious and so ashamed. And she lived with that her whole life.
Mm.
And this affected her whole life since she was a little girl. She was about 55 years old. So for almost half a century, she lived with this emotion of guilt and shame, and she did nothing wrong. You know, it's a normal thing. But the idea that she did something wrong without knowing and being afraid to tell about it, she kept it as a secret.
Yeah.
Okay? So this is very important to acknowledge.
Yeah. So these emotions, especially the powerful ones, the extreme rage, anger, bitterness, extreme fear, on the physical body, how does, for example, cancer, what I understand uh, from the integrative medicine perspective is there has been a persistent and constant cellular contraction brought about by those powerful emotions that eventually led to the something like choking of the cellular mechanisms inside the cell. So
Yes,
am I making sense or
absolutely. And you see the trouble with the way people are being treated for cancer is not honest. I really believe there is a dishonesty in the treatment of cancer by the conventional medicine. Why? Because for 70 years, they've been looking for a cure.
Mhm.
And they are spending millions and millions of dollars to find a cure. But they don't want to find a cure, they want to find something to kill the symptoms.
Yeah.
And it's what happened to my wife. She
Mm.
was a victim of the Western way of medicine to cure cancer because she had a cancer. The doctor said, oh, we cut it off, it would be gone. So they cut it off. It was a breast cancer. And they say, it's gone. And then a few months later, it was in the colon. Oh, they say, see, we can cut that off. It will be gone. They cut some piece of the colon off, and then it came into a liver. Oh, they say, we can't cut that off because it's too close to the blood supply for the liver.
Mhm.
So we'll do chemotherapy. Oh, this is not strong enough. We do stronger chemotherapy. Oh, it's not working. We do radiations. Oh, it's not working. So you're dying. So they tried all this, but they never looked for the cause of her cancer. So personally, I really believe she was killed by cancer treatment
Mm.
because they never looked for the cause. And only after she died, I found the cause of her cancer. I found out she had 2 big traumas, and I found this from questioning her parents. One of the big traumas she had was when she was a baby, about 5 months old. She had a car accident. She was in her mother's arm. Her mother didn't wear a seatbelt, and she was thrown to the ground. Her mother got a broken collarbone, And of course, the mother couldn't take care of her, so she got separated from the mother for I think 3 weeks. So imagine a baby who is breastfeeding in the arm of the mother, and she's thrown to the ground, no mother for 3 weeks, which is a long time for a baby because she doesn't have a sense of time. And the second trauma was when she was, I think, 4 years old, and she watched Bambi, the movie Bambi.
Mhm.
And in this movie, there is a scene where the baby deer is separated from the mother because there is a fire, which came back to her as a separation of her mother when she had the accident. Well, she had nightmares for weeks after watching this movie. And these two traumas never got healed.
Mhm.
And it created pressure into a body, into a cells, this fear. And I remember even as an adult, she had fear of fire and she had fear of car accidents,
Mm.
always. And it was like a fear which was like beyond like a normal fear, you know.
Mhm.
Like she was extremely cautious, extremely fearful every time she was having to drive.
Yeah.
Uh,
But Elle, don't you think that these traumas, in childhood traumas, for example, don't you think there are spontaneous ways that this just resolves also through their growing up years without necessary treatment or reprogramming or whatever?
well, no, everybody is different. So you
Okay.
have never two people are the same. So some people can live very well with one trauma, and it's very obvious, like in the case of twins or brothers and sisters that had a very similar childhood. But for one of them, you know, the way the father acted with them was really, really traumatic, and for the other one, it was like, that's okay. So everybody has different reaction to emotions. So we have to be aware that everybody has a different process.
Yes.
And what can be very frightening for me might be very normal for you. Like some people have vertigo, you know, and if you have vertigo, it's life-threatening because you feel you're going to die. If you are in a high place and you want to walk and you see the abyss, you know, you freeze and your body can't function anymore.
Yeah,
So it
that's
can
true.
be
That's
like,
true. I have a patient who had just very recently, and he had vertigo in the middle of the night, and she got so scared that she thought she's gonna die.
that's why it's a fear of dying.
Yes.
And the vertigo can be transmitted from maybe another generation. That's very possible.
Yeah.
Because I really believe in the genetic transmission of emotions. Or it could be something that happened when they were very little.
Or it could be also our belief structures, as you have said earlier. I
That's
read a
right.
book. The title is The Biology of Belief.
That's true. Yeah. That's a very good book. Yeah.
Yeah,
Biology of Belief. Yeah.
from Bruce Lipton, right?
Yes.
Yeah, Bruce Lipton, by the way, for the audience, is a cellular biologist, and I have read that book, Biology of Belief. It it practically shattered my old belief structures when it comes
Mhm.
to biology. I never thought there is a
Yes.
biology of
And,
belief.
yeah. And even today, there are new discoveries done about the biology of the cell. Like for a long time, it was believed that the nucleus was the intelligent part of a cell, but
Okay,
it's actually the membrane.
okay.
The membrane is the intelligent part.
Oh, it's no longer the nucleus.
No, it's no longer the nucleus, so they have to change the textbooks already on that one. So there are, as we get more and more advanced in microscope and understanding of the cell, it's really interesting because the cell is as intelligent as we are. Each cell has a digestive system, a nervous system, and it's just as intelligent as a whole person. And to the latest count, we have about 37 trillion cells in every body.
Mm,
37 trillion cells. They all work together to keep us alive.
yeah. That's why we have cellular memory, not just the
Absolutely.
intellectual memory, but each and every cell has a memory.
That's right. There's a memory in every cell.
Yeah.
And each cell is made of 100 trillion atoms.
Yeah.
100 trillion atoms multiplied by 37 trillion cells.
So when you do reprogramming, so it's not on the intellectual memory, it's on a cellular memory, am I right?
It's both on the subconscious memory
Mm-hmm.
and the cerebral memories. So we can address the subconscious because this method is without hypnotism. So we can access both sides, the right brain and the left brain simultaneously. And the patient is totally free to change the words, but I ask them to repeat so they can be in control.
Mm-hmm.
The only thing to remember is to avoid using any negative words because negative words are misunderstood by the right brain.
Again, negative
The
words
negative
are
words are
misunderstood
misunderstood by the right brain. So we try to only use positive words. And there's always a way to use positive words in a sentence. And we can actually practice positive languaging, which is very good for everyday life.
Yeah, that's wonderful. Positive languaging in everyday life.
But basically, it's an alternative tapping on the arms. So both arms are being used simultaneously. So what happens? We do this, and this tapping stimulates the brain left, right, physically. And then we add the sentences to it. So first we acknowledge the emotion. And there's a specific order of sentences to be used, which is fairly easy to learn. And I give the sequence and the guideline to all my patients. And then after that, we reprogram the emotion. And there is also a specific set of sentences. So first acknowledgement and then reprogrammation.
Okay.
It's a very simple method, very effective. And to me, the important part is that I tell people I only see you once because I want to empower you to be able to be in charge of your own emotions.
Mm-hmm.
I had a lady, she said, I've been to a psychologist for 2 years every week.
Every week.
Every week. So that's 100 sessions with a psychologist. And she said, I had no results.
Constant customer.
Yes. And then and then she said, with you, I had one session and I had changes right away.
So most of your sessions are just one or two, like that?
One, only do one. Very rarely, if there is an answer that can be answered, I ask a patient to go and find the answer with their mother or their parents, because sometimes something happened in childhood that's very important. And I think it's very good if they can find the answer before we finish the process. But almost everybody has said, you only have one session. It's going to take an hour to 2 hours. But after that, I'll send you the guideline and you're on your own. So all your life, you can be in charge of your own emotions. But some people don't want to heal. They just want to be taken care of. And recently I had a patient. She really wanted me to stay with her every week. I said, no, you can't do that. This is not the way I work. If you want to heal, it's up to you now. You know what I do. You know how to do it. Because there are some patients who want to cling to the healer.
Yeah. You are very unique in that sense, because
I know.
because
but if
with all due respect, but some just say, okay, you come back next week, come back next week, come back next week. Never ending.
I could have said that over and over. Then I will have lined up at my door every day.
Which is not empowerment.
That's right. Yes. So I show people it's simple and they can do it on their own.
So in the session, you teach them.
I teach them. That's right. Okay. So the session is just only to heal them, is to teach them how to heal themselves from any emotion they have in the future.
Okay. In fact, I recently just referred somebody to you, right? And you already met her. Yeah. So now I have this another question. In the medical field, usually people with mental or emotional disorders are labeled. For example, they are labeled with a diagnosis like, oh, you have bipolar disorder, you have a manic depressive disorder, or you have depression, general depression, or you have schizophrenia. So what can you say about labeling? Because what I understand about labeling
Okay.
is also words that could possibly affect the emotions.
That's true. Once you are labeled, it makes it easier for the psychiatrists or the doctors to give you the drugs corresponding to the label. So for schizophrenic people, we give this drug. For people who are bipolar, we give this drug. See? So it makes it very
So
easy because once you
that's
got a label, you got the right to give a whole bunch of associated drugs to this label.
the same
Makes
thing
sense.
actually with some other medical disorders. Like when you are labeled with hypertension, then you get a drug for hypertension.
That's right. Yes. So the labeling is dangerous, I think, and there are new labels every year. In North America, there is the Psychiatrist Association meeting every year, and they decide which new disease they are going to put on the market. And this
Oh,
is not a joke. This is true. No,
it's a
like
fact.
a few years ago, it was what they call ED, erectile dysfunction.
Okay.
So they could sell Viagra. and they are now deciding a label, I don't know if it's already done or not, for women to sell the pink Viagra.
Oh.
Yes. So it's all a manipulation of the market and the beliefs. And attention deficit disorder is a new disease that has been created to sell drugs to children.
Mm. Yeah, because during
And
my medical school time, I don't remember ADHD.
it's something that has been invented. There is no such a thing. But because they have a label, they can sell drugs for it. So it's all a manipulation. I think the big problem is that most schools are boring, and that boys don't learn the same way as girls. Boys have to be much more physical when they learn.
Yeah,
And if you keep them sitting on a desk for too many hours,
they
they
get
get
bored.
so bored and their attention spans will vanish very quickly.
That's right.
And it's just a different way of learning. Like in Denmark, they have the highest results for academics, and they are the people who spend the least time in the classroom. But they take them out, they do field trips, they learn in the forest, they learn on sports, and this is so much more healthy for the child. They need the physical activity to be able to learn. Without this, their brain will shrink, basically. And I remember being so bored at school.
Yeah.
Because at first I was thinking that the teachers were not very smart, so I was challenging them all the time. That was my way of not getting bored. I will always challenge the teachers since early grades. If they said something, I will challenge what they said.
Yeah. All right. So how about this ongoing, pandemic of fear that is happening right
That's
now,
right. I think the fear is much bigger than the actual virus.
the actual virus?
Because when you think of people being confined in their home, can't even see their relatives sick in the hospital, or even see like some people are husband and wife, but one is in the hospital dying, and the other one can't even go and see them. It's crazy.
Yeah, it's a
Or
pity.
families that can get together, and it's not so bad in some countries. Like actually in Taiwan, we had no case of virus since April. Not
Wow.
one case since April. And
Wonderful.
the only thing people do here, they wear a mask in public transportation or in hospitals, but there's no restriction whatsoever. But in
So
Europe, they have
I want to visit.
curfew.
I want to visit you again there in Taiwan, and we go to that buffet vegetarian restaurant.
Yes. That was good. Yeah, that was good. Yeah. But people are living a normal life here. In Europe, they have curfews. You know, in India, they are beating up people if they are seen on the street without a mask. I mean, they beat up people with sticks. It's not going to help. You know, I mean, you are hurting people to protect them. And I think what they are doing, they are taking people's freedoms to protect them. But I
So
think
what?
the freedom is very
So
important.
yeah. So since you've been living there in Taipei, in Taiwan for quite some time already, so what do you think is the difference? I mean, what makes Taiwan so unique in
I
handling
think people
pandemic?
have a good immune system here.
Mm,
People, I think, have a high level of immune system. There is very little drug or alcohol problem here.
mm-hmm,
Very little. I mean, compared to other countries, I think it's a very sober country.
mm.
You know? and and people socialize over tea. We
Over
drink
tea.
tea for hours. You know, so you go to a friend, they will serve you tea, and you drink tea, and really good quality tea, not tea that's
Yeah,
spread with poison. No.
and the
Really high quality tea for hours.
mm,
And I have been several times drinking tea for 5 hours, 6 hours, even 8 hours once.
mm,
And you feel totally normal. And actually, tea is an as antioxidant, which is good for your body.
that's right. And
So the tea,
you gave me one of the best tea when I came there in
that's
Taipei.
right. Yes,
I still remember
yes,
that the very
yes.
first tea you gave me, together with my wife and my son.
Yeah,
So
it's very important.
yeah. So I would like to. Oh, we still have several more minutes. I would like to ask the people who are in the Zoom tonight, and then maybe we could also uh, ask you some questions going through our Facebook channel. But let's
Mhm.
start with the people here in this Zoom right now. So if someone is interested to ask and someone is raising, Richard, is that Richard? Yeah. Can you unmute, Richard?
Yeah, hi. How are you? My
Yeah.
name is Richard, and I am grateful to be here tonight. I enjoyed listening to what you had to say. I have been what I call in the process of recovery for most of my life. I would say I'm 57 years old. I have been pursuing some kind of recovery from trauma for, I would say, 30 years now. Various 12-step groups. I don't know if you're familiar with that. Um, and all kinds of therapy, all kinds of treatments. I really feel like I've never broken through. You know, I've learned a lot. A lot of what you said tonight reminded me of Bernie Siegel's Love, Miracles, and Medicine,
Yeah, I've
and
read that book.
things like this. Wonderful, emotions affect the physical physiology. Yeah. My mom was grew up under Hitler in Nazi Germany, and grew up with the bombs falling on her city. I'm sure traumatized, PTSD. My dad was alcoholic, and I think those two factors combined in our family to make us very shut down emotionally. Actually, a lot of anger underneath the surface, and a lot of trauma and compounded trauma. Compounded. I've gone to treatments and found that that I was diagnosed with compounded PTSD. But and what I've been able to do, and I'll try and wrap this up quickly, is I've researched myself back to 9 months old, when I was nursing at my mother's breast, and she broke her back and had to go to the hospital for weeks. She was pregnant with my sister, actually gave birth to my sister in traction in the hospital. So I believe, if my intuition serves me, that that's where the initial trauma happened. The kind of in relationships, I get feelings of abandonment. And I feel like that initial trauma to a 9-month-old child can be equated to abandonment. And I've never broken through on that. I've never have. So I'm very interested in finding out more about your treatment. And I agree, it's at the cellular level. It feels like it's at the cellular level, the trauma and much of what I went through in childhood. So I just wanted to say that and say that I appreciate listening to you, and I would like to further pursue and get more information at least. So thank you very much.
Welcome. You're welcome to contact me directly on Facebook if you want.
Oh, okay. Is that would I look you up under your name there?
Yes.
Yeah, it's Alkalinado.
That's his name
Okay.
in Facebook.
Yeah.
Okay, great. I will do that. Thank you very much.
Yep.
You're welcome.
So thank you, Richard. Yeah, you can connect. You can connect with El Calinado through Facebook.
This is definitely an emotion to be reprogrammed. The fear of abandonment after being separated from the mother. That's huge. That's huge. Mostly at 9 months old.
Yeah.
Yeah.
So there's a question here in the chat. What emotional disorder is associated with hormonal imbalance, and how to treat it?
Okay, as I was saying earlier, the hormonal imbalance comes from, first of all, the emotion creating a change in the breath creating a change in the endocrine system, and then the endocrine system creating a change in hormones. So we have to find which emotion and also which type of hormone has been affected. So for example, if you have a thyroid problem, most of the time it's a fear of telling the truth or the fear of speaking out a secret. So this is very, very common. People who have an hormonal imbalance coming out of the thyroid. It could also be from the pituitary gland. In this case, it's usually with anxiety, anger, and sometimes having too many things to deal with at the same time, which creates pressure on the front lobe, which creates pressure on the pituitary. And the pituitary being out of balance is going to affect the production of hormones actually in the whole body. Because the pituitary gland is like a gland that commands the other gland in the endocrine system. Is that right? For me?
Yeah.
You're the expert on that.
Somebody asked, it was Aimee. I hope Aimee, you were able
so
to get
through a session, we can question the patient and then find out what was the emotion that caused this imbalance, and then we can reprogram it.
Mm-hmm.
Yes. So it's always a questioning that's very important to find the true cause.
Yeah. So when the reprogramming happens, is it a sure thing that it is sustained through the years?
Well, the reprogramming makes instant changes.
Okay.
It's like turning back a switch.
Oh, it's like a switch.
It's like a switch, and it can reverse the problem right away. Once I had a patient who was actually in a demonstration group, and she was coughing all the time during the presentation. And then she's the one who volunteers to be the model. So I found very quickly that she had the thymus and then the thyroid off with the muscle testing, like with the energy medicine. And I said to her, you must have, for this part, you must have either a secret or you have the fear of telling the truth to somebody. And she said, she was coughing, yes, I do. And I said, what is it? Who is it? She said, well, it's my, my boyfriend. I said, what happened? She said, well, actually, it's not my boyfriend anymore because I don't love him anymore, but I didn't tell him. Oh, so I said, you're afraid to tell the truth to your boyfriend? She said, yes, I do. And then I said, we're going to reprogram this fear so you can tell the truth to him. So we reprogrammed the fear in front of about 15 people who were present. And that was happening actually in Puerto Princesa. And then after we reprogrammed the fear, there was no coughing. So somebody said, that's a miracle. She's not coughing anymore. I said, no, that's not a miracle. This is instant healing. We found the problem, we turn back the problem because we found the cause, and we switch back the cause. She's not coughing, that's normal to me. And same thing happens with cancer, with multiple sclerosis. Of course, with cancer, you can't see it, but with a cough, it's very obvious. And then the lady say, I swear, I have this pain in my throat, it's not there anymore. I said she had an emotional cough. She had to cough the truth, but she couldn't. Now that we reprogrammed this fear of the truth, she's fine. See? So it can be instant. And another time I was walking in a back road with a friend, and suddenly she said, oh, I can't go there. I said, why? There are dogs. I said, well, are you afraid of dogs? She said, yes, yes, no, I have to go back. I said, well, we're going to reprogram your emotion right here. She said, no, no, it's impossible. I said, let's try and find out. And then we reprogrammed this fear of dogs she had. And she, of course, she had been bitten by a dog when she was a kid. So she had this huge fear. We reprogrammed on the spot, on the path. And I said, now let's try and go by the dog, see what happens. We walked, closer and closer to the dogs were barking. And they were loose dogs, they were not attached. And she said, so weird, I don't feel the fear anymore. And we passed by the dog, nothing happened. She said, 10 minutes ago, I couldn't believe I would pass by these dogs. So I think that's a good, simple example on how quickly you can change an emotion.
Wow, interesting.
Yeah.
Yeah. So anyone else in this Zoom group? Oh, Dr. Halad is here. Hello, Dr. Halad. Can you unmute yourself? Maybe she's Dr. Halad is a medical doctor. There's another one here who's a medical doctor. She's from Bohol, Philippines. So anyway, thank you if there's no more questions here.
You can always send me the message, questions later.
Yeah. Because, when we there's some additional questions, we can forward it to you. So, how can people contact you?
The best is through Facebook.
Okay, and your name in Facebook is El Calinado, right?
Right, and it's the only one, so you can't miss it.
Yeah. So you just search El Calinado in Facebook. So he's based in Taiwan, but he does. You can contact him for those who have some.
Lately, I've been doing more online sessions than live sessions.
Yeah, especially during this pandemic.
Yes. People contact me from Europe and North America.
Yeah. So thank you very much, El, for being here.
You're welcome. Thank you for your presence for me, and thank you for your input.
Thank you very much for your time. I will send you the recording. This is recorded.
Thank you.
And thank you, everyone. I hope we all learned something today. Me too. I learned a lot from you. And I will, I hope Kim, the one who consulted you, is getting better now because she's been messaging me. I don't think she's here right now, but
yes.
she's very open. She's very open to,
yes.
To ask.
Well, I think we found the right cause of the problem, so that's the important part.
Okay, so that's a good news. Okay.
That's good news, yes.
All right. Let me see if there are some more follow-up questions. Yeah, there's some more in Facebook, but unfortunately, I'm only using one laptop and I cannot,
Okay.
Yeah.
So, I'll answer the
David is here. Hi, David. Can you unmute yourself, please? Hi, David. Where are you now?
Hello.
Hi, David.
I am in France now. I'm not no more.
You're in France. What time there?
1 p.m.
1 p.m. Okay. I think you know El Calinado, right?
No, first time I meet online.
Nice to meet you, David.
Enchanté.
Yeah, he's from France. Then Daniela is here. Amy, Richard, June, Revi, Daisy, Dr. Halad. Thank you very much for joining us today. And it's good to see you, David.
Yeah, I have a question. I missed
sure.
Because I learned about holotropic breath work, and I actually don't know what El Calinado does. I mean, what's a name, if it's got a name, if it's got a label. I'm curious to know more about holotropic breath work and somatic therapy as well.
Mhm.
That's the
There
kind of
are, there are many,
I know, releasing
yeah,
emotions and helping the body release deeply stuck emotions. So I'm curious to know more. Just
I think the release is something different than the reprogrammation. I think the relief will bring some temporary healing, but it's not a permanent healing.
Mm.
Because, you know, some people say, oh, you have to bring it to the surface. Okay, but then it sinks back down. So, so you think you do some work, but that's actually good, but it's only on the surface and it's going to go back deep into you. So to me, the reprogramming, because I've looked at many methods and I learned many methods, but to me, the reprogramming that I learned with the psychiatrist, Dr. Benner in Canada, is really, really amazing. And I see the results, you know, and I am very grateful for being able to share this method. Because every time I do a session, I share how to do it with the patient so they can do it themselves. And I said to them, you know, it's not a secret. You can share it with as many people as you want, because the more people know about it, the less people will suffer from their emotions.
Yeah.
And I also use it for myself sometimes. No? Once I was going downhill with my children in Whistler in Canada, and they are very good snowboarders. I'm not a great skier, but I went to this hill that was really, really steep, and I thought, my God, I'm going to break my neck. And my kids were gone very quickly, but I was left by myself. And when I started, I realized it was ice. It was not even snow. And I got really scared because I couldn't control my skis. I was really, really scared. So I thought, I'm going to break my neck. And I started to shake. And I thought, okay, that's fear. I have to stop and reprogram my fear. So I very ungracefully stopped with my butt on the hill and put my post in the ice, and I reprogrammed my own fear. And I went to let go of my fear in the cells of my muscles that were shaking, and also in my mind that I was going to break my neck. And when I was totally calm after 5 minutes of reprogrammation, I went down. It was difficult, but I had no fear. And I had no accident. If I kept my fear, maybe I wouldn't be here today. So it saved my life. This little method saved my life, basically. And I have used it several times for anxiety, sometimes for anger. You know, I can feel, oh, this is the emotion I feel. I can
Yeah.
do something about it. I can do something about it. So being empowered with your own emotion, not to, it's not to erase them, it's just to acknowledge them and reprogram them so you can deal with it.
So as David was asking, so how do you name it? It's emotional reprogramming, just like that?
Emotions reprogramming.
Emotions reprogramming. So that's the label, David.
I call it, also call it life improvement through emotion reprogramming.
Uh-huh.
Life improvement.
Through
I call it LITERM, LITERM. Life improvement through emotion reprogramming method.
Okay.
Yes.
At least for nomenclature purposes, we need at least the label.
Yeah, it's a label, but it's a free label.
Yeah. Is this the same as the emotional freedom technique? There's a question here from the chat.
Okay, there is a similarity, but the emotional freedom technique to me is a hit and miss. I learned that a long time ago. It works sometimes, it doesn't work all the time because it's a little complicated and it's a little bit of a hit and miss. So it's like like if you throw 10 stones with one hand, you are more likely to catch the bird that's flying in front of you. But maybe they won't be thrown with any precision. So it's a bit like IOIC-EFT, but it's a good method because it's actually based on this method that Dr. Benner developed, his emotion reprogramming method. So the base of the method is good, but the way it's practiced is a little bit, sometimes it works, sometimes it doesn't work, but for some people it works very well, but it doesn't always work.
So it's different. Yeah.
It's different. It's a little bit longer to learn. Yes.
Okay.
So as this method, you can teach in one session to 12-year-old. I mean, when I see a little kid who is 5 years old, but got the message through the workshop, and I didn't think he was reasoning that well, actually. And then he asked his parents to help him do a reprogrammation of his fear for a nightmare. I think that's wonderful. To me, that was like, yes.
Yeah.
My youngest student is 5 years old.
Yeah.
So I was really surprised. I was like, wow, this is amazing.
Yeah. Amazing. Interesting. All right. So thank you, El, and thank you, everyone.
Thank you, Omi.
Yeah.
Have a good night.
Yep. And have a good night. Thank you very much for the wonderful session, El Calinado. Namaste.
Welcome. Bye-bye.
Bye.
Thank you, sir. Thank you,
Bye.
Rami.
Bye, David.
Thank you.